Today, we'll be presenting Case 11, Right Shoulder Impingement Syndrome. So for this case, your team has been consulted to evaluate an 80-year-old patient diagnosed with right shoulder impingement syndrome. The patient noticed it started when he was having trouble getting dressed in the morning for mundane tasks, such as putting on a shirt or putting on his belt. During your exam, you noticed the following impairments. For range of motion, glenohumeral right internal rotation active range of motion was 0 to 44 degrees, with passive range of motion at 0 to 44 degrees. Strength with right external rotation was a 3+ out of 5. The functional goal is that the patient would like to have enough strength and range of motion to be able to don and doff clothing, shirts, and his belt. The following is an overview of shoulder impingement syndrome. Tendons of the rotator cuff are pinched as they pass between the humerus and acromion during movement. Muscles and tendons do not slide easily. The tendons and bursa become inflamed and irritated. Common signs and symptoms include pain, tenderness, and the inability to fully move the shoulder joint, with pain and weakness when the arm is raised above the head or abducted from the body. Causes and risk factors include injuries to the shoulder, repetitive movements, age of 50 years or more are more likely to develop shoulder impingement syndrome, and bone spurs from normal wear and tear or shoulder osteoarthritis.
A good exercise for this patient would be passive range of motion exercises. The particular exercise we chose was the glenohumeral internal rotation passive range of motion, or also known as a sleeper stretch. The rationale for choosing this particular exercise is the patient presents with active range of motion limited to 0 to 40 degrees, where normal would be 70 to 90 degrees. And this may be due to tight rotator cuff muscles or other passive structures. And glenohumeral internal rotation will help the patient with shoulder mobility as they get dressed in the morning, which is one of their goals. The PT's role with this exercise is to ensure proper body alignment, proper stabilization, to watch for any substitutions that may occur, and to monitor the intensity. Equipment for this would just be a pillow to rest the patient's head on so that they're comfortable throughout the exercise. Starting position and alignment would be side lying on the side that wants to be stretched. So in this case, with the right shoulder, they would be lying on the right side. You want to make sure that scapula is retracted so that it is in line underneath them, and shoulder and elbow are going to be flexed to 90 degrees. Stabilization for this exercise is on the scapula to limit any scapular movement, to make sure that it's just the glenohumeral movement that is occurring. A description of this exercise is once that position is in the starting position with proper alignment, they're going to gently press their forearm down towards the surface while maintaining 90 degrees of flexion in their shoulder and elbow, thus bringing the glenohumeral joint into internal rotation. And they want to make sure their body weight is over the shoulder joint until they feel a gentle stretch in that posterior shoulder. They will then hold this position for 30 seconds and do 3 to 5 reps each time. And they would want to do this exercise 2 to 3 times a week, either first thing in the morning when they wake up or before they go to bed. Substitutions that we are looking for as a PT would be scapular tipping, thus why we stabilize the scapula at the beginning. And dosage parameters for progression, you can either move the shoulder further into internal rotation if possible, or you can place a towel under the arm to allow for an increased range and a deeper stretch. And dosage parameters for regression would just be to decrease the hold time, so perhaps less than 30 seconds, or just decrease the reps. So maybe doing 3 instead of 5 to start.
I'm going to go ahead and start for the internal rotation passive range of motion. All right, Jenna. So I see you're already laying down on your right side, which is perfect. So I want you to take that right arm and kind of move your arm out in front of you and bend your elbow so it's up in the air. Bend your elbow, bend to the elbow. Yep, perfect. I want you to bring your hand and your palm facing down towards your legs. Perfect. Now what I want you to do, keeping your shoulder and your elbow flat against the couch there. I want you to take your other hand and start slowly bringing your arm down, right arm down towards the couch for me. Bring it slow down towards the couch, like your hand, the palm of your hand, down towards the couch. The palm of your hand. Yeah, yep, that way, yep. And now once you feel a gentle stretch in your back shoulder, and stop there. Now I want you to hold for 30 seconds. And we'll say that was 30 seconds. All right, and come back up. Perfect. So I want you to do that stretch, Jenna, 3 to 5 times. I want you to do that stretch about 2 or 3 times throughout the week. Okay? Does that make sense?
It does. Thank you.
Awesome.
An appropriate stretching exercise for this patient would be shoulder horizontal adduction stretch, or also known as a cross-body stretch. And the rationale for this particular exercise is, again, we have possibly tight rotator cuff muscles. So stretching those out is going to allow for an increased range of motion that will enable better strengthening and stabilization during exercises, and improve those as well. And it's going to just overall improve the range of motion and strength, which again fits into the patient's goals of being able to dress comfortably. Same as before, the PT's role is to ensure proper body alignment, stabilization, watch for any substitutions, and monitor the intensity appropriately. No equipment is needed for this, though pillows can be used for comfort. The starting position and alignment is in standing with hips shoulder width apart to ensure a appropriate base of support for stabilization and balance. And then the arm to be stretched out in front, straight out in front of the body. And make sure it's positioned just below shoulder height, so not above the shoulder. Stabilization for this stretching exercise would be the trunk and hips, just to make sure no rotation occurs there. A description for this exercise is you bring that arm that you want to stretch across the body, and then hook the other arm underneath it so that it is hooked around the elbow, and then pull in the arm to be stretched towards the body until a light stretch is felt in the back of the shoulder. Again, hold this stretch for 30 seconds, do 3 to 5 reps, and same thing, they will want to do this stretch 2 to 3 times a week, either first thing in the morning or before they go to bed. And as mentioned before, any substitutions that we'd look for are trunk rotation.
Okay, so this is horizontal adduction stretch, or the cross-body stretch. Okay, Jenna, so what I want to have you do now is we really need to stretch out those muscles. And I see like your cat is really excited for you to do this. So this will be great. She can help you out. So since it's your right shoulder that's bothering you, I want you to take that right arm and just stick it straight out in front of you. Yep, perfect. Now I want you to bring that right arm across your body over towards the left side, and now take your left arm and kind of hook it up over. Now I want you to just slowly bring in that right arm towards you until you feel a stretch again in your upper back and the back of your shoulder. Okay, and then when you have that stretch, I want you to hold it again for 30 seconds, okay? Do you feel that stretch in the back of your shoulder?
I do, yeah. I feel the front as well, but yeah, I do feel the back.
Yeah, that's fine. We're stretching out all those muscles.
Okay.
Okay, we'll say that was 30 seconds. You can stop. Okay, so same thing as before. I want you to do that stretch for 30 seconds, 3 to 5 times. And do that 2 or 3 times throughout the week, like before you go to bed or when you first wake up in the morning. Does that make sense?
Yes.
Perfect. Okay.
So the first strengthening exercise that would be good for this patient is a baseline exercise of TheraBand external rotation. The rationale behind this exercise is that the patient's right shoulder external rotation strength is only 3+ out of 5, and it should ideally be 5 out of 5. So the strength should be improved in order to assist with ADLs such as dressing and grooming, and the patient did state that one of his goals was to be able to don and doff his clothes. The PT's role in this exercise is to observe for substitutions, correct body alignment, and monitor intensity. In addition, the PT can also apply manual resistance against the patient's hand in addition to the resistance applied by the TheraBand. The equipment needed for this exercise is a light to medium TheraBand, a towel roll, a fixed horizontal bar to wrap the band around, and this could be a door handle or really anything if the patient doesn't have access to a horizontal bar. The starting position for this exercise is standing with a wide base of support if needed so that the patient doesn't fall over or feel unsteady during the exercise, so maybe having their feet shoulder width apart or further if needed. Their shoulders should be adducted, and then the elbow should be flexed to 90 with the towel roll between the elbow and the trunk. The patient should be grabbing the TheraBand in their involved arm, so in this case the right hand should be grabbing the TheraBand, and this is also the arm that should be further away from the horizontal bar. The PT should stabilize at the shoulder and scapula to prevent the scapula from protracting forward, and then the elbow would be stabilized with a towel roll to prevent shoulder abduction. To perform the exercise, the elbow should be kept against the side of the trunk, and then the palm should face inwards towards where the band is tied to the horizontal bar, and then the elbow should stay bent while the patient pulls the band away from the body. And then to complete the exercise, the patient can bring the arm and hand back to the starting position. This should be repeated for 12 repetitions and performed for 3 sets and done 3 times per day. Substitutions that the PT should look out for or the patient are shoulder abduction.
All right, Jenna, so we're going to do TheraBand external rotation. So you're going to start with, you can put the TheraBand in your right hand. Yeah, and then, you can get the towel and put it under your right elbow too. Yeah, and then have your feet shoulder width apart and then bend your elbow to 90 degrees. And then you can hold the TheraBand in that hand. Yeah, and then you can keep the towel between your elbow and your body, and then just turn your hand outwards away from the door. Yeah, and then make sure, and then you can put it back to starting position slowly, and then you can repeat that 12 times and just make sure that your palm stays facing towards the door. And then you can repeat it 3 times, 3 sets of 12, and then you can repeat this 3 times a day. Good job.
So if the baseline exercise of TheraBand external rotation was too difficult, the patient could then regress the exercise to a side-lying external rotation. If the TheraBand is providing too much resistance, this movement would be more helpful because it's performed against only gravity instead. And the rationale for this exercise is very similar to the baseline exercise. The patient's right shoulder external rotation is decreased, so they should improve that in order to assist with ADLs, such as dressing and grooming, which includes the patient's goal of donning and doffing clothing. The PT's role in this exercise is to observe for substitutions, correct body alignment, and monitor intensity. The PT, again, can also apply manual resistance against the patient's hand if the exercise is a little bit too easy. But again, this is a regression, so we would want to start with no manual resistance against the patient's hand. The equipment needed for this exercise is a towel roll and a pillow to rest the head on if the patient prefers that. The starting position for this exercise is side-lying with the involved side, so this would be the right side in this case, closer to the ceiling. The shoulder should be adducted, the elbow should be flexed to 90 degrees, and then a towel roll would be between the elbow and the trunk. The patient's involved palm would be resting on the stomach, and then their head would be resting on a pillow or their bottom arm, depending on which they prefer. The PT would stabilize the shoulder and scapula to prevent scapular protraction, and then their elbow would be stabilized with a towel roll to prevent shoulder abduction. To perform the exercise, the patient would keep the elbow at the side and the palm facing downwards of the involved side, and then they would raise that hand up towards the ceiling. And then they would hold it there for 3 seconds and then bring it back down. The patient would perform 12 repetitions of this and then repeat this for 2 sets. And the exercise this whole 2 sets of 12 reps would be performed 1 time per day. Substitutions that the PT and the patient should look for is shoulder abduction.
Okay, and if that exercise is too hard, you could actually lay on your side. Oh. So you can lay with your right hand facing up. And then just, keep your shoulder, get it closer to your body. And then you can actually rest your hand on your bottom arm. Rest your head on your bottom arm. Yeah. And then you could bend your elbow at 90 degrees. And then, keep it close to your body. Oh, sorry, do you still have the towel roll? Okay. You can, again, for this one, put the towel roll between your elbow and your body, and then bend your elbow, and then keep your palm facing down, and then keeping the towel roll between your elbow and your body. You could slowly lift your hand towards the ceiling. Yeah, and then make sure you keep your palm facing down, and then you can hold it for 3 seconds and then go back. And then you can repeat that 12 repetitions twice, and then just do this once a day. Good job.
Once the patient has demonstrated proficiency with the more remedial versions of this exercise, we can promote further challenge by progressing to the same external rotation movement, but in a position of shoulder abduction. This position will require the external rotators to synchronize activity with some of the other rotator cuff musculature, including the supraspinatus, and create an overall more demanding challenge. Proficiency in this position is particularly critical for many ADL, including basic tasks such as dressing and grooming. The key with this exercise is to isolate glenohumeral external rotation without allowing for compensatory activity such as scapular protraction-retraction or lumbar extension. It's also very important that the elbow remains fixed in place and that the shoulder joint doesn't move into a more adducted position as the patient fatigues. This exercise can be started at 3 sets of 8, and additional volume or resistance can be added to progress even further. All right, Jenna, so you've been doing really great with the shoulder strengthening exercises that we've been working on. I'm really happy to see the progress you've been making. So we're going to try something a little harder today. How's that sound?
Cool, let's do it.
Great. So you're going to start by facing that wall with the band tied to it. And I want you to grab the band in your right hand. And you can start by lifting your elbow up towards the ceiling. You're right. Yep, good. And from there, without moving your elbow, I want you can bring your right palm towards the ground in front of you. And then you're going to bring it back to where you started, towards the wall behind you. Yep. And then back towards the ground. And I want you to keep repeating that. So as you continue to do that, I want you to think about what muscles you feel working.
There?
In the back of the shoulder?
Yeah, like up here and then right in the back.
Okay, great. All right, we're going to do 3 more. 2 more. All right, 1 more. All right, you can take a little break. So you did great with that. We'll give your muscles a chance to rest, and then we'll do 2 more sets. And I'm confident that as you continue working that, your shoulders are going to get better and better.
Great, thank you.
So lastly, we'll go through the home exercise program that we developed for our particular patient who, as we remember, has right shoulder impingement. These 3 exercises are going to be convenient because they could all be performed at the bedside. when the patient wakes up or before they're going to sleep, and they shouldn't take too long. The first stretch or the first exercise that the patient will be performing is the sleeper stretch. So just as described before, patients laying on the side that's affected, so they'll be laying on their right side and they'll be performing the sleeper stretch as described here in this description. The patient's going to be holding this for about 2 minutes. We want them to not go to a point of pain when they're doing the stretch. We just want to make sure that they're feeling the stretch, but nothing painful or anything like that. The patient's going to repeat this about 5 times, and we want them to perform this once a day. Second exercise is going to be the side lying external rotation. So just as described earlier, patients laying on their side, they're going to be laying on the side opposite of the affected extremity, and then they're going to have a pillow wedged between their arm and their side, and then kind of keeping that elbow tucked. They're going to be going through their full external rotation range of motion. For this one, we want the patients to perform 12 repetitions and do 2 sets. And then also we added that the patient's going to hold at the apex of the motion for about 3 seconds. Last exercise we have here is the prone external rotation liftoffs. So for this one, patients laying prone, head's going to be supported either by a pillow or a towel, and then shoulder and elbow is going to be at 90 degrees, kind of the position pictured here. Ideally, we would want the patient to also have a rolled up towel underneath each elbow when performing this, just to prop the elbow up. Basically, what we're going to ask our patient to do is keeping the elbow on the table and your wrist in neutral. We want to lift the hand off the table, and patient's going to be performing 3 sets of this, 12 repetitions, and then with each repetition we want them to do a 3-second hold at the apex of the motion or their end range. Something also pretty important to consider with the home exercise program is the reassessment and the modification of the home exercise program. So the home exercise program isn't by any means stagnant. It's not something that's going to be the same forever. Based on our reassessment of the patient by next visit, and then also the feedback that the patient gives us after we ask them about how it was performing this home exercise program, we may modify this home exercise program. What that looks like is we might regress or progress a certain stretch or exercise just to make sure that we're continually taxing that right shoulder and addressing the impairments kind of in a more comprehensive way. All right, Jenna, so we're giving you a home exercise program to take home with you. For now, we have 3 exercises. We like to call them anytime exercises because we want you to do them kind of at your leisure whenever you have kind of the time to do it. But we do ask that, you do perform these, every day. So 2 of the exercises are actually going to be ones that you already worked on today. The first one being that sleeper stretch that was discussed earlier. And then the second one being that side lying external rotation. So laying on your side, elbow kind of tucked in and bringing the palm out. This one's going to be slightly different, but it should be targeting those same muscles. It's going to be called the prone external rotation liftoff. So for this one, you're going to be laying face down with your arms out to your side at about 90 degrees. So that would be right about here. Great, just like that. And you're going to have them resting on the table, actually. What you're going to be doing is ideally, if you had a rolled towel, you could place that kind of proximal or a little bit before your elbow just to kind of prop your arm up. But I mean, we could try it right now with this and you'll let me know how you feel. But what you're going to do is keeping your elbow on the table, you're going to lift your arm in this direction backwards while keeping the wrist neutral. So I don't want you bending at the wrist, and I kind of want you to keep it neutral. And try doing that. Elbows and shoulders going to be staying on the table, all right?
All right.
Let's see a few repetitions. Great. And you're going to hold for about 2 seconds and go down. Okay, and you're going to be doing this. I want you to do about 12 reps and try to do it. Try to do that at least 3 times. So 3 by 12. And then just to get some feedback, can you let me know where you're kind of feeling, if at all?
Like the back of my shoulder, like the other exercises.
Okay. All right, great. Nice. So, like I said, try to do that about 12 times with a 2-second hold at that top, kind of the apex of that motion, and then go back down. We'll maybe just do a couple more reps right here. Okay, and one more. Great, thank you.